Yeah, no problem. Good morning, everybody. My name is Tracy Bonoffski, and I'm a faculty member at the University of North Carolina at Charlotte. So I just drove in this morning. It's about an hour and a half away. And I appreciate you all being here this morning and supporting our cohort. We're really excited to get this over in a good way. My visual or my digital poster and my dissertation focused on interprofessional education. So where I work at UNC Charlotte, I'm part of a smaller college called the College of Health and Human Services. And within that college, we have 5 disciplines represented. We have kinesiology, public health, social work, nursing, and health systems management. One of my roles at UNC Charlotte is to coordinate a learning community, which has first-year students who are represented from all of those majors. And so I thought it would be a neat topic to try to find a way to allow these students early on in their academic career how they can start to learn and collaborate together. And so that led me to the topic of interprofessional education. Interprofessional education basically means that you learn from, with, and about one another, and it's when students come together from different allied health professions to push forward better health outcomes. My study overall incorporated mixed methods, so I had a survey of 50 faculty at the Charlotte campus. All 5 disciplines were represented, and from the survey, we found overall high scores when it comes to their attitudes and beliefs and thoughts around interprofessional education. A few of those are highlighted on my poster. So they felt it was extremely important that students learn how to work with others early on in their academic career. They also felt like interprofessional education is essential as we train our future healthcare professionals. And lastly, they felt that it was interprofessional education is significant in pushing health outcomes in the right direction. As part of that survey, I did find some lower scores, and those are also highlighted up here on the digital poster. Some professions felt as if their profession was not as highly valued as some of the other professions on campus. So for example, public health faculty felt that maybe their discipline was not viewed as important as, say, nursing was. And they also mentioned that they do find it difficult to seek out help from other disciplines, and that they would like to find a way to make that a little bit easier. And lastly, they felt a little limited in their knowledge of interprofessional education. So in order to push this initiative forward, they felt as if they would have to maybe have some training or learn a little bit more about the actual topic. Lastly, for the interviews, I found that by interviewing the faculty, they mentioned what would help them push interprofessional education forward. They did find that understanding one another's roles within the profession, collaborating and supporting teamwork among students was extremely important, and they were definitely supportive of that and felt as if our administration on campus was also very supportive of that. But they found there are some barriers. For example, we have limited funds. I'm sure that's not a surprise. Public institution, limited funds and resources to support interprofessional education. They also found it's very difficult to coordinate schedules of faculty from various disciplines. So although the want is there, coordinating is extremely difficult. Getting students from all the different disciplines together at the same time, and classroom space is also a problem on our campus. And then faculty workload, of course. Faculty want to be involved, but yet felt as if maybe it may not fit in their workload. And so trying to overcome these barriers would be extremely important. So lastly, just to conclude, I'm hoping that my study will lead to maybe some sort of a path or roadmap to pushing IPE forward on my campus and maybe other similar campuses, and that we can learn how to overcome some of the barriers that were identified and continue to support the facilitators that were highlighted in my study.